Teeth misalignment, such as crowding, high canine, maxilla protrusion, open bite, and crossbite. With abnormal teeth, the contour of the face and the bite function are greatly affected. To improve the misalignment of teeth, the orthodontic treatment is necessary. A 14-year-old boy with high canine teeth on both sides of his mouth would need orthodontic treatment. Dental braces and brackets are necessary to cure the misalignment of teeth. When putting constant pressure on your teeth, the teeth will move. This is the basics of orthodontic treatment. In 1971, Japanese professors Masuhara and Miura developed a strong adhesive that allows the brackets to cling to the surface of the teeth directly. Due to the development of DBS brackets and the super elastic night-tie wire, the application of the orthodontic equipment has become easier than ever. Orthodontic techniques have evolved over time. The edgewise technique was developed early on by Dr. Angle, a pioneer in the field of orthodontics. Then came Dr. Tweed's Tweed method. Other techniques developed later included the Begg method by Australian Dr. Begg, Europeans' FKO method, light wire technique by Dr. Reckitt, straight wire technique by Dr. Andrews, and Invisalign technique is more recent. All of these techniques have been introduced in Japan. The results were quite different from each other due to varying styles and methods of the orthodontist. The Tweed orthodontic method attempts to optimize teeth alignment and link one's facial profile and changing jawbone line angle, resulting in patients' perfect occlusions of excellent facial prosthetics. Dr. Klant, currently the chief instructor of the International Tweed Study Course, stated when examining a patient,
when a patient has a orthodontic problem, there are usually three things we need to look at. One is the facial balance and harmony. Two is the crowding of the dentition. And three is the protrusion of the tooth.
Face is first. This is a key word of Tweed orthodontic operators. A face with good balance, harmony, and proportion is the ultimate goal of the Tweed technique. Dr. Tweed was Dr. Angle's student. He had worked with Angle, treating patients, and helped develop the edgewise orthodontic equipment until 1930. Tweed used Angle's non-traction method to cure patients for 10 years, but the prognosis did not come out as expected. Dr. Tweed treated his 100 patients again, which created a better teeth alignment and facial profile. Teeth extraction if necessary, and as a result, an excellent treatment was developed. The Tweed study course began in 1941 and lasted for more than 70 years. Today, there are more than 300 orthodontists who attend the Tweed study course to learn the specialized technique and philosophy each year. It is the longest continuing orthodontic study group in the nation. Japanese orthodontists have been attending the Tweed study course since the 70s. The ear rod eyeball lower margin line, the lower front teeth axis line, the lower border of the jaw line, FMA, FMIA, IMPA, these three angles comprise the Tweed triangle. By the late 1940s, Tweed had discovered vast improvement of the facial aesthetic by repositioning the lower anterior tooth and counterclockwise rotation of the jaw. During the early 1950s, Tweed had decided that in order to achieve optimal facial aesthetics, the IMPA angle should be at 88 degrees, which is 3.52 degrees less than the average of 91.4 degrees chosen by orthodontic analyst Down as the optimal angle in his analysis. Due to differences in genetic makeup, the average value of the Japanese Tweed triangle is 27 degrees FMA, 57 degrees FMIA, and 96 degrees IMPA. The FMA value is much larger than the FMA angle for Caucasians. For those in the malocclusion group who require treatment, most of the FMA angles are larger than 30 degrees. Due to these large angular value differences between Japanese and Caucasians, use of the Tweed technique in Japan was in doubt. There were Japanese articles related to clinical orthodontic shown in a magazine called Profile, published by Tweed International Foundation. In 2007, Dr. Ozaki presented very precise clinical data of well-treated bicuspid plus molar extraction, but severe cases of more than 40 Japanese people. His work proved that the Tweed technique is just as effective for Japanese people as it is for Caucasians. Facial beauty is subjective and transitory, as it is dependent on fashion and culture. As a result, orthodontic trials can be difficult to express as data. At the international meeting, Tweed member Dr. Hase reported excellent and satisfactory treatment results for 70 high-angle Japanese patients using the Tweed method. The average final IMPA angle of the treated patients was the same as Tweed's ideal value for Caucasians, 88 degrees. From his findings, Hase concluded that IMPA 88 degrees is an effective angle for both Caucasians and Japanese with regards to facial beauty. In 1960, Lightwire technique founder Dr. Rickett challenged Dr. Tweed on the basis of theories developed by Down and Steiner. Since then, the Lightwire technique, as well as the straightwire and bioprogressive methods, have made a positive impact on clinical orthodontic treatment throughout the world. Unlike Rickett's Lightwire technique, which emphasizes growing control and induction of the teeth, the Tweed method is performed on permanent teeth after the eruption of the second molar. The difference in timing as it relates to application of each technique is apparent and often leads to differences in treatment results. For 70 years, the debate between Dr. Engel and Dr. Tweed on teeth extraction and non-extraction is recurring and ongoing. In the article, A Brief History of Orthodontic, published by AJO and DO, Dr. Tweed is described as a strong advocate of good facial aesthetics. Even 70 years later, his ideas and methods continue to be used effectively across the clinic dental industry. If you are considering orthodontic treatment, it will be worth your while to read up on the Tweed method before making a final decision